This presentation is on foot care for the elderly. It's presented by Petty Health Services Incorporated. What we're going to go over today is the anatomy and physiology of the foot, and we're going to discuss why foot care nursing is important, as well as what a foot care nurse does and how our company Petty Health can help. It was Leonardo da Vinci who said, "The human foot is a masterpiece of engineering and work of art." And when we learn more about the foot, you can really see that this is true. Because each foot is made out of 28 bones, 30 joints, and more than 100 ligaments, tendons, and muscles in your body. The foot actually accounts for 1/4 of all the bones in your body. And there are about 100 to 200,000 extraceptors or nerve endings that send information uh, from your foot to your brain. So that is why uh, uh, feet are very sensitive and they can be very ticklish. Sometimes foot ailments can become signs of more serious medical problems, and your feet usually mirror your general health. So there's sometimes when we can see the first signs of poor circulation, maybe signs of peripheral vascular or peripheral arterial disease when we're performing foot care with people when they're usually asymptomatic or they don't show any symptoms at all. We can sometimes see the first signs in their feet. So there's three main functions of the foot. Your foot is responsible for weight transmission. So when you're walking, standing, jogging, your weight is distributed evenly, and the foot is also responsible for keeping you upright. So it balances posture, it gives you an equilibrium. So again, while you're standing, walking, and jogging, it's keeping you upright, it's distributing your weight, and of course, it helps you with walking. So your feet get you from one place to another. As we age, the feet tend to spread. Um, and sometimes, for example, our shoe size tends to change. So before you buy any shoes, make sure that you're trying them on. That also goes in particular for different brands of shoes. Say if you are a size 6 in a Nike shoe, maybe in a New Balance shoe, you would be a size 7 and vice versa. So it's very important that you try shoes on properly and never assume that your shoe size has changed. Um, so again, as the foot ages, the foot gets flatter and it gets wider. The bottoms of the feet also lose the fatty tissues or the fatty pad, the ball of your foot, just where you tippy toe. So a lot of the times there's callus formation on that area, what the fatty pad is. And also skin becomes thinner and elastic. Um, it may get injured, it's more dry, more prone to infection. So certain things like athlete's foot and little cuts and scrapes can lead to long-term damage. Ligaments and tendons also lose their ability to stretch normally. This causes toes to crowd and to bend. So sometimes people have what we call claw toes, mallet toes, or hammer toes, and that's from the ligaments shortening and not being able to stretch. Nails also tend to become thick and very brittle. The average person will walk around 115,000 miles in a lifetime, and that is more than 4 times around the earth. It's true that the foot or feet, your feet are the most neglected part of your body, but also the most used. It's really a shame how people use and abuse their feet. When I see young girls wearing these high stiletto heels and wedges, I think I'm going to be in business for a long time. But really, just like any means of transportation, if you're if you're using a bike to get somewhere, if you're using a bus or a car, you care and maintain for that. But when it comes to our feet, that even gets us from point A to point B, say from your bedroom to the living room. Sometimes we don't really think about how we're treating our feet. So I think it's really important to know how how much we actually do use our feet in our lifetime. So, a foot care nurse is a nurse who takes additional training in anatomy and physiology of the foot. And we also learn how to perform non invasive treatment of foot conditions. When I say non invasive, that means that we don't break any of the skin layers. So, we don't do anything underneath the skin, we don't use scalpels or blades. We do collaborate with physicians and podiatrists, social workers, other nurses, wound clinics, physiotherapists, and other healthcare professionals if we do see an issue. We do a lot of collaborative and multidisciplinary care for each client. We are also regulated health professionals, which mean we're held to a higher standard and we have to abide by a certain standard of practice. That being said, for example, we are not estheticians. So, estheticians or people who go for pedicures and you have someone caring for your feet, they do not have the same skills and training required to deal with foot conditions. And we are governed by the government and must sterilize all our equipment and practice best practice guidelines in order to continue to practice and to keep our nursing license. So, all of our equipment is sterilized by Health Canada standards. If you go into a salon or a pedicure place, sometimes they will say, yes, my tools are sterilized, but whether or not that's to Health Canada standards may be another story. All our equipment is usually, like with Pedi Health, we autoclave our equipment. So that basically is the same as surgical equipment, the way that it's processed and used. So the chances of infection are very, very minimal. Foot care is really crucial for people who have difficulty caring for their own feet. If you're diabetic, you're at very high risk for amputation and foot complications, and that's just because um, when you have diabetes, that decreases over time the sensation that you feel on your foot. So, for example, I've had a lot of clients who have stepped on a stone or stepped on a little tack and they haven't felt it before. I actually had a client come in to see me and he had a small screw um, in the fatty pad of his foot. It didn't break the skin, but he said he was outside in the garage and he had been wearing bare feet. And this little screw was embedded in his skin and he didn't even notice it. Sometimes people with poor circulation are very high risk for infection. People with autoimmune disorders, if you have a history of foot ulcers, if you're undergoing dialysis treatment, arthritis, or have any other foot condition, it is very crucial for you to see a foot care nurse because of the decreased immunity, poor healing, and poor circulation. And of course, with any of these conditions, it could lead to a lot of complications. And the best way to treat complications is really to prevent them. You want to be proactive and you don't want any complications to form. And that's something that a foot care nurse does, and we'll discuss that more. So, for the initial treatment, we have you sign a consent. And once you sign a consent with our company, with Pedi Health, we make sure that your foot care needs are met. We would obtain a medical and nursing health history, and we'll look over all your medications, we'll look over your health history, and we'll assess and compare like what kind of needs and what kind of foot care needs do you have. And then we'll complete a foot assessment for you. So we'll check your pulse, we check your skin integrity, We check your circulation. We check if you have bone deformities. We evaluate how you walk, and see how we can help you the best we can. We also perform what we call a monofilament test. And this little test shows how well somebody can perceive sensation. So we'll do that the first visit, and if there's issues or concerns about sensory uh, deprivation, then we will definitely check it out and follow up and see if things are getting better or getting worse. We also do non-invasive foot care and nail treatment. We'll assess and make any recommendations for footwear. We'll assess and make recommendation for skin conditions if they have dry skin, fungal infections, fungal nails. We'll usually make recommendations for that as well. Um, After the first treatment and every follow-up treatment after that, we usually see people every 6 to 8 weeks or as needed. We continue to do ongoing assessment and evaluation. We note if there's any kind of changes. We'll bring that up and intervene as soon as we can. We'll do toenail clipping and filing. We'll remove ingrown toenails, corns, and callus. We'll reduce them and file them down. And if we do see any potential for skin breakdown, we'll pad the tender areas and see if there's anything we can do to prevent any future problems. We'll also massage your feet, and again, we do this every 6 to 8 weeks, and you don't have to book an appointment with us if you are on the foot care program with this facility. Common foot care conditions that we deal with is diabetic neuropathy, callus, corns, seed corns, bunions, fungal nails, bone deformities, athlete's foot, ram's nails, ingrown nails, etc. We deal with a lot of foot conditions. And needless to say, basically, there's so many foot conditions that are out there, and I can't really just name a few, but this is just, I can just only really name a few right now, but this is just a touch of what we have to offer in terms of treatment. Over 75% of people will experience a foot problem in their lifetime, so we do help with that. This client here has what we call a ram's nail. His nail was very fungal, and it was growing, as you can see, in a totally different direction. It was very uncomfortable in his shoe, and he saw us for the first time, and we were able to help him. So here's a before and here's an after of his treatment. So as you can see on the after picture, his nail was actually not even attached to the nail bed. The nail was so thick that it was lifting. So had we not done anything, the potential would be that that nail would get injured and maybe injure his toe, or would completely flip off and damage his nail bed or the nail at the base of the nail on the toe. Hopefully, over time, this nail will grow out healthier. But this client was very happy, and he was much more comfortable. The toenail was actually really digging into his second toe, right underneath the on the joint there. So thank goodness there was no skin breakdown, but have we not intervened at that time, this could have been a very, very complicated and difficult scenario to treat. So the benefits of foot care are that they prevent complications such as infections, foot ulcerations, amputation, osteomyelitis, which is infection of the bone. It improves outcomes for patients. So when we see clients, again, it's the early intervention, it's the assessment, the things that we see right away that may get overlooked by other people that we treat and will really help right away. It promotes mobility and prevents falls. I'm sure you may have experience in your life like a small blister or a corn, and if you're not wearing the right shoes, you'll stop walking. In the elderly, it's very important to keep them mobile, and sometimes something like a small corn could just stop them, and um, they're not motivated to walk anymore because of the pain. So we prevent that. It also reduces unnecessary referrals to secondary care providers and unnecessary hospital stays and admissions. Again, because we intervene early, we take a proactive approach to health and not a reactive approach to health. So we prevent the problems before they even occur. And this picture is just an example of uh, a toenail that, or a client. The healthcare aides were cutting this client's toenails, and because of many issues, he didn't want to see a foot care nurse and whatnot. He started to complain of toe pain, and when we came and did an assessment, we realized that this client had a spicule, or like what this thing here is called a spike. You can see me pointing at it with my instrument there. But in the first picture on the left, it doesn't look like there's anything wrong with that toe, but he was complaining of extreme pain, and he was complaining of pain when he walked, so he wasn't walking as much. And again, when we did our assessment and we continued to look further, we noticed that there was a piece of nail growing into the skin. So foot health has a fundamental link to health and the well-being of individuals, and as well as the economy. It costs our government $16,000 to amputate one toe. So if you can think about how much it costs our government to amputate a leg or a foot, this is $1 billion to our healthcare system. Whereas foot care nursing provides prevention for these complications and can prevent amputations by up to 85 to 90%. So infection, ulceration, and amputation, again, this is disabling pain and significantly impacts mobility, independence, quality of life, and the ability for a person to work and care for others. If you have any questions, please feel free to email us, contact us anytime. You can visit our website, www.pettyhealth.net, and we also sell footwear, diabetic socks, and adaptive clothing products. Our 1-800 number is here. You feel free to email me, like us on Facebook, and follow us on Instagram. Have a wonderful day, guys.